My name is Dr. Krista Jordan, and I'm a psychologist here in Austin, Texas. I wanted to talk today a little bit about what is ADHD. I'm just going to keep this super simple, so if you want more information about ADHD, I have some on my website, and I will be putting links to different really good reputable sources at the end of this video. ADHD is a neurodevelopmental disorder. What this means is that it starts in childhood, that's the development part, and that it's issues of the brain and the central nervous system, that's the neuro part. So a neurodevelopmental disorder, one that arises in childhood and tends to persist all the way through adulthood. It's actually a myth that people with ADHD as kids outgrow it as adults. At least 50% of the symptoms tend to persist, and what ends up happening is adults develop some adaptations usually to some of the symptoms, but not all. So ADHD is thought to be genetic, runs in families, and it just has to do with the way that the brain is developing during pregnancy based on the genes of that particular embryo. So this is not something that kids can control, or adults for that matter, and it is going to impact the way that they move through the world. The areas that tend to be problematic with kids with ADHD and also with adults would be things related to figuring out how to motivate oneself when you are not interested in something. When I used to work with kids a lot, parents would be confused because they would tell me, well, he doesn't have any problem paying attention to video games, therefore he doesn't have ADHD, because part of ADHD is trouble paying attention. And what I would try to explain is that yes, there are problems with attention and concentration and memory in ADHD, but really the bigger problem for a lot of people is a motivational issue, where when they need to push themselves to do something that they don't want to do, they have trouble activating that motivational system in the brain. For example, I don't particularly enjoy filling out paperwork, but if I have to sit down and fill out a bunch of forms, I have the ability to sort of reach inside my brain, if you will, and engage that motivational system that tells me, okay, come on, you can do this, and afterwards maybe you can go get some ice cream or, take a break, and you'll be done before you know it. And I can use all these kinds of motivational aspects to push myself to do something I don't feel like doing. With a kid or an adult with ADHD, when they have to push themselves to do something that is not appealing to them, they're kind of reaching around in their brain looking for that motivational system, and it's not really there. So we don't really have to motivate ourselves to do things that we enjoy. They're inherently pleasurable. We need to engage our motivational system when we have to do something we don't really feel like doing, and that is really deficient in the ADHD brain and nervous system. So you'll often see difficulties motivating to do things that you don't feel like doing. For sure, problems with attention and concentration. Now, paying attention and concentrating on something are the gateways to putting it into memory. So we see some impairments in memory, and particularly in something that's called working memory, which is the super short-term memory that only lasts for maybe 10 or 20 seconds. This is the kind of memory that's involved if somebody tells you their phone number and you're looking for somewhere to write it down and you're repeating it to yourself. That's working memory. And kids and adults with ADHD tend to have a lot of problems with working memory. Some kids and adults with ADHD have what's called a hyperactivity component, where they are very fidgety, squirmy. When they're kids, they often climb on things they're not supposed to climb on, jump off things they're not supposed to jump off of, and in general are just pretty hyperkinetic. In adulthood, some of that can persist for some people, but a lot of times adults will learn to restrain themselves. They're not going to jump up on the middle of the conference table in a board meeting, but they may have a feeling inside like they wish that they could get up and run around the room, but because they're in a board meeting, they're just going to have to sort of sit there and tolerate that uncomfortable feeling in their body. That's another common feature. So sleep is often disturbed with ADHD. Kids and adults can often have trouble falling asleep because it's difficult to switch gears in the nervous system. That's something that the ADHD brain doesn't do particularly well. So gearing the nervous system up, like waking up in the morning, can be a little challenging, and shutting the nervous system down for sleep can be a little bit challenging. And kids with ADHD often have trouble transitioning between activities because, again, it's that idea of engaging or disengaging the nervous system, and it can be a little rough for them. especially in childhood. So these are just some of the differences that we see in the ADHD brain and nervous system. There are many more, and I'm going to follow this with a video on how to evaluate ADHD, and if you're considering evaluation for your child or for yourself as an adult, what are the things that you would want to know to make yourself an educated consumer of an ADHD evaluation. So I hope you have found this informative. And if you have questions, please feel free to email me. I'm always happy to help direct you to services. I no longer evaluate children. I did in years past, but don't do it anymore, but I'm happy to recommend people, and I do evaluate adults still. So more on that in the next video. Thanks and take care.